Oh, oh, there it is. Hi. Biomechanics. Yes. Mhm.
I was emailing you.
Okay. Yeah. Oh, nice to meet you.
Okay.
Yeah.
Is it okay if I?
Yeah.
Thank
Mhm.
But the other thing, I was going to school and actually, but I wasn't really my backpack in the car, so I think I'm more on top in my car. I need to leave it. Yeah, and then like the boss. And then I heard it go around, push, what are you doing? They didn't draw my mom. So that's a. Oh, yeah. Yeah. I was just thinking. Yeah. I'm sure. Better. Yeah.
Oh, okay.
Yeah, but I think.
I guess it's.
I don't know about. I always see them around, but I always know. So I always, now it's now that I think I don't. I think, I said that. I think very much. No, and which they have, it's really great to be like as a ball. Yeah, I'd say.
But I did it.
Well, they're the yeah, yeah. He's somebody right? I think so, yeah.
Sort of like.
We just, it's like ready. Oh, yeah.
Yeah, but I guess.
Yeah, I think I don't know, the next thing. Oh, could you go with it?
Yeah, I'll crack it.
Yeah. I should say it's. I just want
I'm scared. I know.
Surprisingly. That's fine. And then meetings.
I would like to achieve.
I think he, because he was playing the game, he couldn't play well during those play. And then switch to hard boards. Like it's a way to restart this. No, he.
Oh, maybe.
What good is it? Sorry. It's
Yeah.
Who is that? Someone put it on. Beach. Names a song.
Oh, we like that.
Generally. I'm trying to pass out.
That's GME.
All right, it's 4 o'clock. Let's go and get started. All right, good afternoon, everyone. How's everyone doing? Making it through the first week of class, halfway through, about halfway through. So yeah, a couple more, a few more days, and we're at the weekend again. All right. So today I have another set of lecture slides for you guys. This week's a little bit unusual just because it's the first week. I usually don't like just using slides. Normally I have an iPad and a pencil, and I write the notes kind of live. But just, for the first day, it's just the first day. I just, slides are kind of natural for that. And then for today's topic, today we're going over basic anatomy, right? So just based on that, there's a lot of images, a lot of figures for me to show you. So, that's why I have slides for today as well. So, I know with slides, I tend to talk very quickly. I realize that when I'm out of breath, but starting next week, you'll see me with the iPad and pencil. Okay. And another thing that's a little bit unusual today is that there are a lot of learning objectives. So there's 14 here. Normally, this is definitely abnormally large as well. Normally, I'll have maybe 3 or 4 learning objectives per lecture. It's just that today there's just a lot of information that's kind of condensed into one lecture. Okay. Kind of the necessary evil of learning biomechanics is that you have to learn about the biological system that you're working with. For us, it's the human body, and so that necessitates kind of learning about the names of the bones, the muscles, the joints, as well as just kind of general terminology about the whole thing, right? Normally, if you were taking kind of like a general anatomy class, this may be kind of spread out over at least 2 or 3 lectures. But we got to get into the engineering stuff. So I kind of crammed it all into one here. And so there's going to be a lot of names, a lot of terms today. I don't expect everyone to kind of memorize everything after today. It's something that's going to be kind of a process that we're going to go through the whole semester. But you should at least be exposed to it. Okay. I think quite a few people who have sent me their emails already have kind of have a little bit of concern in terms of just the amount of vocabulary and the amount of memorization that you have to do. I'm hoping to kind of cut down on that. And so my approach with this is that to kind of expose you to all of it today, and then as these kind of structures and bones and muscles, as they become relevant again later on in the class, I'll kind of remind you kind of what they are. Okay, so today is kind of just be a very quick kind of very crash course into this stuff. Don't feel like you have to really memorize everything, but just try to absorb kind of as much as you can, just to kind of get used to the terminology. Because the thing with biomedical and biologists and stuff in general, that the way that they name things, the way that they call things, is a little bit quite different than what we're used to in engineering. So you kind of have to have almost 2 different kind of mindsets with this. Okay. Other announcements. And so just a reminder that homework 0 is due this Sunday. So remember, homework 0 is just to send me an email. So please make sure you do that. I think a lot of people in the class have already done so. I'm slowly kind of working my way through and kind of responding to everyone. But just make sure you get that in before Sunday to get credit for that. Homework 1, which would be the first kind of real homework assignment. I'm still working on it. I should have it, hopefully have it posted before the end of the week. I'm aiming for a due date of next Friday for the first homework. First homework is gonna be pretty chill. It's gonna be mostly just kind of mostly conceptual questions. Mostly just kind of just naming the vocab, tell me the names of these muscles and so on. Just so that you can kind of not only hear it in the lecture, but also kind of commit it to memory in the homework as well. Okay. All right, any questions on any of that before we get started for today? Okay. All right, so let's go ahead and get going. Okay. So actually, let me jump back up here. So, the title of these lecture notes is skeletal and muscle anatomy. Those are the skeleton. You'll learn later today is the primary kind of load-bearing tissue or organism within your body, and the muscles are what generate movement. Okay, so we're going to focus a lot of this class on those things. So we need to know their names, and we need to know how to refer to them. Okay. Okay, so what is anatomy? And so when you define anatomy is really just simply the names of things, right? So the names of the bones, the names of the muscles, the joints, and the regions of the body. Okay. So anytime you have a scientific discipline, anytime you're studying something, you need to have some kind of unified way to name things. Otherwise, you can't really discuss things with people if everyone's calling things different, right? It's the same for engineering, right? And so we call a force. We call unload, pressure. It's the same thing in every realm. So, before you kind of really learn anything, you kind of need to learn the language first. And so anatomy is kind of the language of biomechanics. Okay. So I will say that, when you're first learning the terms, it can be a little bit intimidating, just because of the sheer volume of terms that you have to know. And so, it's just like any language, it takes time, it takes practice being exposed to these things to really kind of nail it down. And so again, I don't expect everyone to really memorize everything after today. Just kind of get used to it. Maybe some of these terms are familiar with you. I know, talking to some people over email, some people are kind of into, working out and lifting. And so I think maybe hopefully some of the names of the muscles should be familiar to you. But just kind of keep practicing it and keep kind of, asking yourself what that is and you'll get it down. Okay. So these lecture slides, I kind of designed them in a way to, not be too fussy. And so I want them to be a reference for you guys throughout the semester. So if at any point during the semester, say you're working on a problem or you're working on your project and you forget the name, or you come across a term in a paper or something and you're not sure what that refers to, I mean, of course you can always just use Google, but you can always use these lecture slides kind of as a reference for you to help with that as well. Okay. Okay. So we'll start with kind of a very important concept for this course, which is called gross or whole body modeling. Okay. And so the idea with gross modeling is that we're going to break up the human body into 17 different segments. Okay. Where each of the segments are kind of separated by a major joint in the body, right? So the thing with the human anatomy is that it's very complex, but we have to kind of simplify it in a way in order for us to do calculations, right? So this is kind of the first level of kind of simplification that we have to do. Okay. This is not the only way to model the human body. Depending on what your goals are and what type of knowledge that you're seeking, you may model it in a different way. For example, if you look at the model for the hand, right? The hand is just a circle in this case. The hand is just kind of one big block. But if you look at your own hand, your hand is actually one of the most complex pieces of bones and muscles in your body. Just because your hands can move in so many different ways. But to kind of save us on some of that complexity, we just model it just kind of one big chunk. And to kind of go back to probably what you've learned before in kinematics or maybe in dynamics, we consider each segment of the body here as kind of one rigid body. So the entire upper arm moves together, the entire lower arm moves together, the entire hand moves together. Okay, so this is going to make our lives really simple when we start to talk about biomechanical analysis, computing things like muscle forces, joint reaction forces. If we can model the entire segment of the body as just one, it really kind of simplifies things. Okay. And so I mentioned that each of these segments here are broken up by a major joint. And so if you look at how this body's kind of broken down, that's kind of how we generally expect the human body to kind of move as well, right? So if you look at the arm, the upper arm here, I gotta bring my own mouse. This is terrible. But this upper arm here, you can see at the upper end, this is the shoulder joint. So that's one of the major joints in your body. And then down here is the elbow joint. But in between the shoulder joint and the elbow joint, it is possible to have some movement there. If you kind of pinch, your muscles or they're kind of, can move a bit. But for the most part, most of the movement happens at the joints, and the entire upper arm, for the most part, moves as one rigid body. Okay. Same with the lower arm. Same with the hand. Hand and feet are a little bit unique just because they have just all of your carpals, metacarpals, things like that. Upper leg, lower leg, feet. If you break, your pelvis is separated from your mid abdomen to your upper torso, your neck and your head. Okay. And so for all intents and purposes, when we refer to a segment of the human body, we're referring to kind of a rigid body. Okay. And a lot of the analysis that we're going to do is computing what are the forces, what are the accelerations, the velocities on these rigid segments when they're acted on by the muscle forces or the external forces and things like that. Okay. Okay, so let's look at the names for these. So these names are really nothing special. They're kind of exactly kind of what you expect. The only thing to note here is that for the most part, this numbering is fairly arbitrary. The only number that's kind of most important is number 1, which is your pelvis. The reason we label that as segment number 1 is that that's kind of closest to the center of mass for most people. Okay, and so it just kind of naturally makes sense to call the segment that's where your center of mass is segment 1. Okay, And then from there, it's kind of labeled somewhat arbitrarily. So we have 1, 2, 3. That's all of these segments in your torso. 4, 5, 6. That's your left arm. I didn't think about it for a second. Left upper arm, left lower arm, left hand. Then you have your neck, your head, right upper arm, right lower arm, right hand. Upper leg, lower leg, right, left, and so on and so forth. Okay. So these names, these ones are pretty intuitive. We're not really getting into the biological terms yet, but these are kind of important to know. Just in terms of how we model the human form. Okay. All right. Any questions on this so far? Okay, pretty straightforward. Okay, so of course, there are more detailed models out there. If you're talking like, the hand, I mentioned the hand a few times. The hand can be broken down into many more parts, right? So this is kind of a more detailed model which shows the individual bones, albeit with very simplified shapes, just circles and ovals. But this is kind of a more detailed picture of the bones in your hand. Okay, so if you were designing a device that's meant for the hand. Maybe you would use a model like this. This would be more helpful for you than kind of just imagining the hand as just one particular block. Okay. Same thing with the vertebrae, the spine. So we'll touch on the spine a bit later today. But the spine is actually made up of all these little vertebrate bones that are kind of stacked on top of each other. Okay. And so if you're looking at particular maybe spinal injuries, we're going to talk a lot about hernias later in the class. Maybe you want to use a more detailed model of the spine, which kind of has each of the bones kind of individual segment there. Okay. And that's the thing, when you're working with a very complex subject like the human body, you're gonna hear me use the term modeling a lot in this class. Okay. And so a model for something is nothing more than just kind of a simplification of kind of what the reality is. Okay. Because a lot of real life phenomenon, to be perfectly honest with you, is very complex. But in order for us to kind of understand it, to kind of work with it, do calculations, we have to simplify it in some kind of way in order to kind of do that. But of course, there's different levels of simplification that you can do. So you can do something very simple, like imagining everything is just a rigid body, or you can do something a bit more complex. And how you choose to model things is actually a very important consideration that you have to do anytime that you're doing analysis. Okay. For the most part, we're going to be working with fairly simple models like this, but just know that more complex models like these also also are relevant. Okay, so that's just kind of the very basic in terms of how we break the body down into different segments. Okay, another really important concept to learn as we go throughout the class is to learn about what I call positional and directional terminology. Okay. So just like any kind of engineering system that you're analyzing, you need some kind of coordinate system to define the positions of things, right? And the human body is no exception. And so in order for us to kind of locate where certain things are in the body, it's always good to have some kind of coordinate system. So traditionally for engineering, we're probably most familiar with the Cartesian coordinate system. So that's X, Y, and Z, which is a set of orthogonal vectors that define certain positions. But for human body modeling, there are other kind of systems for us to learn as well. Okay. Cartesian coordinate system, we're still going to use those. We can't really escape our DNA as engineers. We love Cartesian coordinate systems. But there are other kind of terminology and systems to learn when we're talking about biomechanics. Okay. Okay. So let's talk about the principal planes first. Okay. So the principal planes, these are, the three kind of orthogonal planes. And so if you think about kind of the three planes for, a typical Cartesian axis, we have the XY plane, XZ plane, YZ plane. For biomechanical modeling, we have these two. It's just that, we have to give them names. Okay. So there are three principal planes. And, the idea with these planes is that each plane is going to split your body into two halves. Okay. It's just that you can split them in halves, three different ways. And so the first principal plane that we have is called the coronal plane. Okay. And so the coronal plane kind of splits kind of your skull and kind of goes right down your body, kind of parallel to whichever way that you're facing. Okay. And so the coronal plane is important because it splits your body into a front section. So those are the regions of your body that are in front, and a posterior section or a rear section. Okay. The front section is also sometimes called anterior. So anterior and posterior are opposites of each other. Okay. The next plane what we have is the transverse plane. So the transverse plane kind of cuts you right at your pelvis, and so that cuts you into an upper section and a lower section. Okay. Upper body, lower body. Those are terms we're going to use a lot in this class. Okay. And then lastly, we have the sagittal plane. The sagittal plane kind of cuts right down the helm of your nose, and it splits you into a left side and a right side. Okay. So things that we are very familiar with, the front, back, left, right, top, bottom. It's just that we have to give them planes, give them names. So we have the coronal plane, the transverse plane, and the sagittal plane. Okay. If you ever have a chance to get an X-ray done of yourself, or like an MRI scan or a CT scan, you'll see that the radiologists and the doctors use these terminology a lot. And so, if they're discussing that in front of you, you can kind of, show off a little bit and kind of, say like, oh yeah, anterior to my coronal plane, I think I have a broken bone. So you can kind of, join the conversation a bit on. Wait a second.
With a broken bone.
Oh yeah. Well, I'm like, what is a radiologist going to talk about? They're going to talk about the broken bones in your body. Okay. Another important aspect that we're going to talk about are reference configurations. So we are going to be talking about this a little bit more kind of in the second half of the class when we're going over dynamics. But one really useful concept that we're going to do is attach little mini coordinate axes on each of the segments of the body. Okay. And so you can see from this figure here, we have our same kind of gross whole body modeling person here. Except that, for each segment, or for most of the segments, we've attached a individual coordinate axis. Okay. And then just kind of based on the kind of the traditional XYZ kind of the directions, that's why these coordinate axes are Y and Z. Whereas if you look from the side, this is X and Z. Okay. I think I kind of skipped it a bit earlier, but the X axis kind of traditionally points forwards, excuse me. The Z axis points up, and the Y axis kind of points towards your left. Okay. Okay. So these are going to be really helpful, because what we're going to see later on when we get to dynamics, one way that we can kind of quantify motion in the body is to compute the relative position of two body segments relative to each other. Okay. And so if you look at kind of the motion of your elbow, right, and so your upper arm and your lower arm, right, one way that you can describe this motion of kind of curling your arm forwards is that the angle in between your upper arm and your lower arm is getting smaller or getting bigger. Okay. And so the way that we kind of quantify that is by attaching these kind of what we call local coordinate systems to each of the body segments. Okay. And so of course, we need to have some kind of starting point. And so when someone refers to a reference configuration, that refers to the position of a person's body such that all of these local coordinate systems are exactly parallel with each other. Okay. And so one very common position for someone standing up is just standing up with your arms to the side. And so everything's kind of as vertical as it can be. And so in this configuration, all the Z axes are parallel to each other, all the Y axes are parallel to each other, all the X axes are also parallel to each other as well. Okay. And for a sitting position, a sitting reference position could be something like this. Sitting is a little bit awkward just because when people sit, their arms are kind of always kind of skew a little bit. So that's why you kind of have this kind of weird position where this person's kind of, signaling that someone made a field goal or something like that. That's kind of the easiest position to get, all of these coordinate axes to be parallel to each other. Okay. With that said, these aren't the only reference configurations. When you're studying motion, maybe a different reference configuration. Maybe it makes more sense to kind of have your reference configuration be at the start of the motion. Okay. So later on in the class, we're going to talk about motion capture in terms of how that's used to study biomechanics. And oftentimes, motion capture is used to study, maybe how a golfer kind of swings their club. And so maybe it makes more sense to have a reference configuration from, when they start their motion. Okay. But this idea of having a reference configuration and using these local axes to, define kind of relative positions is something that's going to be really important for us. Okay. All right. Any questions on this so far?
Is the axis gonna stay the same in the whole throughout the movie?
No, it changes. And so, the idea is that, let's say, this person raises their arm, right? Just think. Okay, so let's say that they start raising their arms so that their upper arm is like this, their lower arm is attached to it as well. And so the axes are going to always stay kind of in the same relative position to the segment. And so if you were to kind of, let me change the color here. And so if you were to kind of plot out the coordinate axes, it would look something like this. So the z-axis would still be kind of parallel down the long axis of the segment, and the y-axis would still be kind of this way as well. So this is y and z. Okay. And so this is really important because, if we wanted to kind of quantify the motion of this upper arm, we would look at the difference in angle. And so if we were to take this axis right here, y3, kind of place it right here, right? We can compute this angle in between those two coordinate axes. And that's one way for us to kind of quantify the motion or quantify the relative position between the segments. And so those local coordinate axes are going to stay attached to the segments. And then the relative position is what we're going to use. Yeah, good question. All right, any other questions on this? Okay. Cool. Okay, and so another set of terms that we are going to use here is relative positional terms. So these are a little bit more informal. We're not going to do too much with this. This is kind of more for use in kind of hospitals and things like that. But oftentimes, if you want to describe kind of the exact position of something in the body, usually it's good to kind of start from kind of a big landmark, like maybe the shoulder joint, and then describe the position of a certain something relative to that landmark. Okay, so this is particularly helpful when you're describing, maybe the location of an injury, right? And so say that you work, let's say that you work in a hospital, you work in an ER room, someone comes in with a big bruise on their upper arm, right? And if you need to describe that injury to someone else, maybe the leading physician or the or maybe a nurse in kind of the next shift, you would say that patient came in with a large bruise that's distal to their left shoulder joint. Okay, and so what that basically tells them is that the injury is right here. Okay, so it's just kind of help with this is mostly kind of in the realm of when you're describing things with just simply words or simply writing. If you had a visual, that'd be a different story. But if you were to describe things with words, this is how you would do it. Okay, so we have this set of 8 kind of relative positional terms, and so they all come in pairs. And so the first 2 there are superior and inferior. And so when you say something is superior to something else, that means it's closer to the head or closer to the top of the person's body. And then inferior would mean closer towards their feet. Okay. The next 2 are anterior and posterior. So we've already seen these terms. So anterior means towards the front of the body. Posterior means towards the back of the body. Okay. The next 2 are interesting. Next 2 are proximal and distal. So proximal means towards the torso, and distal means away from the torso. Okay. Again, kind of referencing that notion that the pelvis or the torso is kind of the center, the centroid of the human body. Okay. And then 7 and 8 are medial and lateral. So medial will be towards the midline of the body, and lateral will be towards the away from the midline of the body. Okay. And this is, if you want kind of a referencing a term that we used before, this is towards and away from the sagittal. Okay. So again, we're for this class, we're not going to do too much with these terms just because, we're mostly doing analysis and calculations. And so a lot of times we'll have visuals or we'll have kind of, exact coordinates of certain things. But it's good to know when you're kind of reading papers or you're reading articles about these things, what these terms actually mean. Okay, next we're going to have movement terminology. So we have a lot of terms that we can use to describe movement. Okay, so the very most basic term that we have here is flexion. So flexion is when whenever you make a bending motion, and kind of the more exact definition is whenever you make the angle between 2 body segments smaller. Okay, and so the most common motion for this is you're kind of flexing at your elbow. And so when you're flexing at the elbow, the angle between your lower arm and your upper arm is getting smaller as you flex. Okay. Another example of that is at your knee. So the knee joint and the elbow joint are 2 of the most common hinge joints in the body. where that's kind of where these terms kind of most naturally kind of occur. Okay. The opposite of flexion is extension, and so under extension, the relative angle between two body segments is getting larger. Okay. So when you're extending your elbow, it kind of looks like that. Okay. And so, just be a little bit careful here, just because, and I make this note just because you guys are, this is an engineering course. Sometimes we use extension in the context of solid mechanics to mean something that's getting longer or elongating. But your limbs aren't actually getting longer in this case. It's just the angle that's kind of straightening out. Okay. So when I refer to extension, it's just, it's more rotation to make this angle bigger. We'll talk a little bit about kind of growth and remodeling, how bones actually get bigger, but it's not going to be too much of a focus in this class. Okay, so some other movement terminology that you may come across is bending. Okay, and so kind of the example here is for the neck, right? The neck joint is actually really interesting because it's pretty much a ball and socket joint, and so you may be wondering, why do we call this when you move your head to the side? Why is that bending? Whereas if you move your neck forward and back, that's flexion and extension. Okay. Because technically, if you move your head to the side like this, the angle between your head and your shoulder is getting bigger and smaller, right? The reason we have this, and this is true for all the ball and socket joints of your body, is that we need to differentiate, whenever you're bending forward and back, going versus side to side. Okay. So flexion and extension is usually front to back for the most part, and then bending is usually side to side. Also for your ball and socket joints, it's possible to rotate at them. Okay, so you can kind of rotate your neck kind of back and forth. So that's another type of motion that you can do. Another ball and socket joint that you have is your shoulder, so you can kind of rotate within your shoulder joint just like this. Okay. Another type of motion you can have is supination and pronation, and so these are opposites of each other. And so supination is the motion where you're kind of bringing your palm upwards, and so you're kind of rotating your palm so that it's kind of facing up. And then pronation is kind of the opposite of that, where you're kind of rotating your palm down. Okay. One thing that you can do, so I always do this whenever I learn things, is to kind of come up with little silly kind of ways to remember this. And so the way I remember supination is that you're rotating your hand upward to hold a bowl of soup, right? So soup for supination, right? And then pronation is just the opposite of that. So whatever works for you. Okay, next one we have here is adduction and abduction. Okay, so adduction is the motion kind of, it's kind of most obvious with the arms and the legs. Adduction is kind of bringing your legs kind of closer to your body, whereas abduction is the opposite. Abduction is kind of bringing the legs or the arm away from your body. Okay. So the way I remember this is that adduction is that you're kind of adding to the midline of your body. You're adding to kind of the overall structure of your body. So that's why adduction means bringing in, whereas abduction is the opposite of that. It means going out. Okay. The next one we have here is something that's unique to the ankle joint. So it's varus and valgus. Okay, so this one's a little bit hard to visualize, and admittedly, this picture is actually pretty terrible at this. But a varus configuration, normally if you're standing up, your toes kind of naturally point kind of outwards in a V. So a varus configuration means you're kind of bringing your toes inwards. Okay. Whereas a valgus configuration means you're bringing your toes kind of outward. You're kind of opening up that V as much as possible. Okay. So varus and valgus are mostly terms used to describe someone with kind of an abnormal kind of standing posture, an abnormal gait, not really for motional that much.
Does that have anything to do with bow-leggedness?
It does, yes. So bow-leggedness, oftentimes it's associated also with the varus or valgus configuration. I believe bow-leggedness, you're mostly going to be valgus because your knees are kind of out and your toes are kind of out. Yeah. Mm-hmm.
Is varus the one that's in oil?
Varus is in. Yeah. Mm-hmm. Yeah. So we'll actually spend a week, maybe a little bit over halfway, talking more specifically about we call it gait biomechanics, so like the biomechanics of walking and posture. So that's something that's really relevant for everyone. So yeah, these terms will come back. Okay. Any other questions on this so far? Okay, a few more terms that are kind of unique to your feet. We have plantar flexion and dorsiflexion. So plantar flexion means kind of pointing, kind of driving your toe kind of into the ground, and dorsiflexion means kind of flexing your toes upwards. Okay. So the way I remember this is that plantar flexion, you're kind of planting your foot into the ground, and so you're kind of driving your foot downwards. This is kind of a very essential motion to walking, and so in order to kind of propel yourself forward, you kind of drive your toes and your feet into the ground to kind of generate force. Okay, and dorsiflexion is kind of the opposite of that. So dorsiflexion, the way I kind of remember it is if you think of like a fish or like a dolphin, the dorsal fin is the one that kind of sticks up. And so dorsiflexion is kind of, you're kind of sticking your foot up to kind of make that motion. Okay. Okay, and so the last ones that we have, these are associated with the ankles. We have eversion. So eversion is kind of when you kind of rotate your feet to kind of, where you're kind of resting on the insides of your feet. And then inversion is kind of the opposite. Okay. So eversion and inversion, these are very common ways to describe ankle injuries. And so if you've ever played sports growing up, soccer, basketball, football, you've probably sprained your ankle at some point. The most common type of ankle injury is an inversion type injury where you kind of, your foot kind of bends outwards. And it's really interesting actually, and the only reason that happens is that just because of the structure of the human body, it's just much more likely for you to kind of rotate your ankle outwards rather than inwards. But if you ever do get an injury where you rotate your ankle inwards, it's actually pretty catastrophic because the ligaments and the tendons on the kind of the inside of your of your ankle are not really designed to stretch. And so if you end up tearing a ligament there or stretching a ligament there, it can put you out for a long period of time. Whereas if you have an inversion ankle injury, those ligaments are a lot more flexible. So if you sprain your ankle, with an inversion injury, maybe you're out for like a week or something like that, but you're back at it, pretty quickly usually. Okay, depending on the severity. Okay, so that's everything with movement terminology. So again, very, very, very quick. That was kind of a crash course of all those terms, but we'll come back to them, and I'll kind of make sure to kind of remind you. The nice thing about being here, as opposed to Zoom, is that I can kind of show you the motion, right? So the first time I taught this class was over COVID, and I was trying to describe abductions like this, but my webcam's only so big, and so it was kind of goofy. But at least you here can kind of see me do this. Okay, so next let's talk about skeletal anatomy. So these are the names of the bones. Okay, so we're doing honestly a very simple treatment of the bones. And so there are a lot of bones in your body. Over 200 of them, I believe. But we don't need to know the names of all of them because most of the bones in your body they count all the individual rib bones, they count all the individual vertebrate bones, all the individual finger bones, and so for the most part we don't need to know the names of all those tiny bones, but it is helpful for us to learn the names of all the big bones in the body. Okay, so these are the ones that are mostly kind of bearing the weight. So these are primarily the weight-bearing bones. And these are the ones that also provide the attachment points for all the tendons and ligaments for your muscles to attach to. Okay. So all of the bones are kind of summarized in this figure right here. And if you kind of compare this to our figure from before, from gross body modeling, you can see that most of these bones refer to kind of one bone kind of refers to one segment of the body for the most part. Okay. So we'll start from the top, and so your head bone is called your skull, right? So I think everyone kind of knows that. Next thing we have here is the sternum. So the sternum is kind of the bone that kind of goes right in between your ribs. Okay. Next we have the clavicle. So the clavicle is a bone that is on your kind of rest at the top of your torso that kind of connects to your shoulder. Okay. The clavicle is really important because it's one of the few bones that you can actually touch. You can kind of feel it pretty well from the outside. It doesn't have a lot of padding, so the clavicle is one of the most commonly fractured bones in your body. So if someone strikes you kind of below the neck on the side, it's probably going to fracture your clavicle. It's also a very thin bone. It's not a very thick, doesn't have a lot of meat to it, so that's why it's fractured a lot. Let's go into the arms. So the humerus is the bone for your upper arm. There's only one of them. For your lower arm, we have two bones that are kind of parallel to each other. So we have the radius and the ulna. Okay. The difference between those two bones is that the ulna kind of has more of an articulating surface with your elbow joint. And so it's, you know, this picture doesn't really do a really good job of it, but, you know, if you were to kind of draw this, if I were to kind of draw this out, the ulna kind of has a bigger platform like this. It's kind of thicker towards the elbow and kind of thins out towards the wrist, whereas the radius is kind of opposite. The radius is kind of thicker towards your wrist and kind of becomes thinner up towards your elbow. Okay. Okay. And then it's not here, but all your hand bones, we refer those to the carpals and the metacarpals. The carpals being kind of the larger bones, and the metacarpals being the ones kind of at the tips of your fingers. Okay. All right, and then now we come to the pelvis, and so the main pelvic bone here is called the ilium, right? So again, the pelvis bone is another one that is kind of comprised of a few bones fused together, but the ilium is kind of the big one that kind of you know, forms most of the structure there. Okay. The ilium attaches directly to the vertebrae. So I don't have it labeled here, but the vertebrae is your spine. Okay. So your spine is one of those bones that's comprised of, you know, multiple different bones stacked on top of each other. But collectively, we can refer to the spine bone as just the vertebrae. Okay. Moving on down to the leg, we have the femur, which is the bone of the upper leg. Okay. The femur is a very strong. It's one of the strongest bones in your body because it bears pretty much the majority of the weight whenever you're standing up. Okay. The femur also has a very interesting geometry in that, you know, you can't really see it here, but there is kind of a very kind of prominent. This thing would work. There's a very prominent that we call it the head of the femur that kind of attaches into the ilium. Okay. And that actually makes that connection between the femur and your pelvic bone kind of forms your hip joint. And your hip joint is one of the most stable, kind of important joints of your body. Okay, next we're coming down to your knee. So the kneecap, which is the bone that you kind of feel on the front of your knee, that's called your patella. Okay. Next we have the lower leg. So the lower leg kind of has a similar kind of geometry as your lower arm. There are two bones that comprise the lower leg. We have the fibula, which is kind of the tiny bone in the back, and then the tibia, which is kind of the larger bone that's kind of in the front. Okay. And then similar to the radius and the ulna, the tibia kind of is thicker, closer to the knee. And so the attachment between your upper leg and your lower leg is mostly a joint between the femur and the tibia. Okay. And so you can see it's a little bit better illustrated here. You can see it's kind of a thicker bone up here. It kind of thins out at the bottom a bit. Okay. Whereas the fibula is kind of the opposite. The fibula is kind of thicker, a little bit thicker at the bottom and thinner closer to the knee. The fibula doesn't really articulate with the knee at all. Okay. Any questions on Mr. Bones here? Okay, good. So again, you know, very big crash course, but you know, we'll be talking about bones, I think not next week, but the week after that. So, you know, all these terms will come back. But you know, I just wanted to kind of expose you to this today. Okay, so let's talk a bit about the structure of the bones. Okay, so because the bones are actually one of the most interesting tissues in the body, right? So I think contrary to kind of what some people believe, you know, the bones are one of the hardest structures in your body, but they're still actually technically living tissue. Okay, so your bones can still grow, they can still adapt, they can still kind of repair itself, and it can only do that if it was kind of living tissue, right? So I think some people kind of get the misconception that bone is kind of this, you know, inorganic kind of, you know, structure inside the body, but it is actually made of real tissue inside. It's just kind of laced with a lot of calcium and stuff to give it strength. Okay. So in particular, in this slide here, I'm talking about the structure of a long bone. So these are the bones that make up our limbs. And so things like the humerus, the ulna, the radius, the femur, the tibia, you know, basically all the bones in the arms and the legs kind of have the same structure. Okay. So all of these bones are basically cylinders with rounded ends. Okay. And so the biological term for the cylindrical part is called the diaphysis. And then the rounded edges are often called the epiphysis. And I always hesitate pronouncing those because I almost always get it wrong, but those are kind of the terms for that. Okay. The reason we kind of refer to these differently is that they have very different properties, very different structures. And so the cylindrical shaft is often, you know, that's where kind of most of the strength is. That's where you have most of the calcium. That's where, you know, most of the load bearing takes place. Whereas the ends, you know, they kind of have a larger surface area that kind of helps to kind of attach to other bones and attach to muscles. And they tend to be, you know, sometimes a little bit spongier too, right, to help kind of absorb impacts. Okay. The other thing that's kind of important to know with bones is kind of the soft tissue that attaches to them. So you've probably heard the term ligaments and tendons before. Ligaments are soft tissues in your body that connects your bones to other bones, right? Whereas tendons are soft tissues that connect your bones to the muscles. Okay. So the connection between your bones and the muscles is really important because that's basically how your muscles enact motion on the human body. And so, you know, your muscles need a point of attachment, and so it attaches at the tendons. And for the most part, the tendons kind of attach at the ends of the bones. Okay. All right. Any questions on this so far? Okay. Okay, so just a very quick slide of your skull. So even though we oftentimes consider the skull as kind of one big bone, it actually is comprised of, you know, multiple bones kind of formed together. Okay. And so, you know, if you've ever, you know, looked at a baby's anatomy before, you know, the skull is something that's very precious for babies because, you know, they're all these bones in the skulls for babies are still kind of moving around each other and still kind of forming bonds. Usually by the time you get older, you know, the intersection between these skull bones are mostly kind of fused together. You know, there's not really a lot of movement. But when you're really young, you know, I'm talking kind of infants and toddlers, you know, these connections are still pretty soft. And so it's really important for young kids to kind of protect their skull because you don't want to mess up, like you don't want to, you know, move these bones away from their final resting. Okay, so let's talk about the spine a little bit. So I've mentioned a couple of times today that your spine is made up of all these different vertebrate bones. Okay, you know, they're all just kind of stacked on top of each other, and the spine itself can actually be you know, separated into four big segments. Right, so starting from the bottom, so the bottom here, this is kind of the part of the spine that kind of peeks out in the ilium, in your pelvic bone. This is actually the pelvic bone that often people refer to. So this is often called the sacrum. Okay. Next, we're moving up to the lower back. So the lower back part of your spine is often called your lumbar spine. Okay. That's usually the part where people have issues. So, you know, if you have bad posture, if you you know, don't sit up well in your chair, a lot of times a lower back pain is some kind of discomfort or some kind of issue with the lumbar spine. Okay. You know, hopefully all the chairs, I'm looking at these chairs, you know, these chairs aren't bad, but usually if you're going to be sitting for long periods of time, you want to have lumbar support. Okay. We'll talk a lot more later, but you know, whenever you don't want to put too much stress on your lumbar spine because that can cause issues like, you know, hernias and things like that. Okay. Next, we have the portion of your spine that refers to the upper back. So the upper back is the thoracic spine. And then we have the cervical spine, which is the part of the vertebrae that's actually in your neck. Okay. So the cervical spine, you know, your neck, thoracic, upper back, lumbar, and lower back, and then, you know, tailbone or pelvis is your sacrum. Okay. Part of the reason, you know, we kind of make this distinction is that if you kind of notice from this figure, every time we jump from one section to the next, kind of the curvature of the spine kind of changes. Okay. And actually, you know, maybe it's a bit hard to see from this figure, but you're kind of viewing someone from the side here. You're not viewing them from the back. And so, you know, their head would kind of be up here, you know, and their eyes would be right here, and their face like that. Okay, so you're kind of viewing someone from the spine. So it's natural to have kind of some curvature in the spine, but the curvature should go anterior to posterior. Okay, and every time kind of the direction of the curvature changes, you know, we define that as a different segment of the spine. Okay. Okay. But yeah, the spine, very important, you know, especially when you're talking about ergonomics and kind of designing workstations for people. You want to make sure that, you know, you try to alleviate as much stress from the spine as much as possible. Okay, so let's talk about the joints. And so the joints are going to be something that's really important because this is where, you know, a lot of the motion takes place in the body. Okay. So the joints in your body, you know, we often characterize them by the type of movement that's allowed. Okay. Because if you look at your elbow joint is kind of the quintessential hinge joint. Okay, so a hinge joint is a type of joint which only allows kind of 1 degree of rotation. Okay, there's a little bit of wiggle room in the elbows. You can kind of move it side to side a little bit, but for the most part, most of the motion is just kind of inflection and extension. Okay, The other kind of quintessential hinge joint is the knee, although the knee has a little bit more flexibility than the elbow. Okay. The next type of joint is a slider joint. Slider joint only allows 1 degree of translational motion. Right? We're not going to talk about these too much because the most common slider joints in your bodies are kind of in the parts of the body which we have too many bones to count. So in your hand and your feet and your ribs, right? Oftentimes, just so that your hand can kind of slip into certain kind of positions, we have slider joints in between the bones in that body. And the third type of joint is a ball and socket joint. So this is kind of the most flexible joint that you have in your body. And so they allow for the greatest kind of range of motion. So the biggest examples of the ball and socket joint would be your neck joint, your shoulder joint, and your hip joint. Okay. Also, your wrist and your ankles are also pretty close to ball and sockets as well. Okay. In truth, there are other categories of joints that are in the body. If you want to kind of be technical, there's no joint in your body that's a true ball and socket joint. There's some limitations that are imposed by the ligaments and the bones. So these are kind of more just as a kind of a rough description. Okay. And even within the category of ball and socket, there are different kind of categories of how much motion that you can allow. Right. Because your shoulder joint is a lot more flexible. It has a lot more range of motion generally than your hip joint. Okay. And there are terms for that as well. But just for our purposes, just to kind of differentiate between, a hinge joint and a ball and socket joint and a slider joint, these terms are enough. Okay. All right. Any questions on this? Cool. Okay, so let's talk muscles. And so I'm not going to talk too much about muscles today. Just because we're going to talk about muscles a lot in this class. We're going to talk about muscle dynamics, how they work kind of at the molecular level, to kind of the forces that they generate. But it's helpful to kind of understand kind of the big kind of groups and big terms for muscles as well. Okay, so before I get to the figure on the right, first we need to discuss the 3 types of muscles that you have in your body. So the first type of muscle is a cardiac muscle. So the cardiac muscle are the muscles that are inside your heart. So the reason we kind of separate these is that your heart, your heart is the one muscle in your body that can never rest, because your heart is responsible for pumping blood throughout your body, right? And so because of that, because it's constantly kind of operating, it's constantly pumping, it has to have a kind of a very kind of specific structure. It has to have a very specific function. Okay. So it's very different from all the other muscles in your body. So that's why we kind of define it kind of separately in its own category. Okay. The next type of muscle that we have are smooth muscles. So these are muscles that are, muscles that are kind of part of your internal organs. And so almost all of your internal organs kind of have the ability to kind of, clench a little bit or kind of expand or contract just to kind of help with its function. And so I'm talking about things like your intestines, your blood vessels to a certain degree, your lungs. There's little kind of muscles in there that kind of help with some motion to kind of get some things moving along. Okay, but in general, these smooth muscles are not that powerful. So cardiac muscles and smooth muscles, we're not really going to touch on this class at all. We're mostly concerned with human movement, and so for 99.9% of the time, we're going to be talking about skeletal muscles. And so these are the muscles that attach directly to your bones. And these are the ones that are used to produce motion, okay, motion of the human frame, right? So the muscle groups that you're kind of seeing on the right, so things like the biceps, the triceps. Biceps are kind of the muscles that are kind of on your upper arm that produces elbow flexion. Triceps are the muscles on the back of your upper arm that produces elbow extension. Trapezius is kind of the muscle, kind of your neck a little bit. Your deltoids is kind of your shoulder muscles. The hamstrings. Hamstrings are the muscles in the back of your leg. Quadriceps are the muscles in the front of your leg. Gastrocnemius is one of your calf muscles. It's not the only calf muscle, but it's one of the main muscles in your lower leg. Some muscles that aren't here are your abdominals, of course. Your abs are the muscle kind of in your abdomen here. We have your latissimus dorsi, or your lats. Those are kind of your back muscles over here. Okay. So there's lots of muscles in the body, and so it's important to know kind of some of the names of the major groups. If you're into working out, if you're into lifting weights, probably these terms are familiar to you, but just know that we're going to use them throughout the class. Okay. So one other important thing I want to talk about here is that muscles only have the ability to shorten or contract. Okay, it's actually impossible for a muscle to actually lengthen by itself. Right. The way that a muscle lengthens is that you have a kind of a complementary muscle that kind of produces the opposite motion. Okay. So the simplest case for this are your biceps and your triceps. So whenever your biceps kind of contracts, that kind of pulls your elbow, kind of pulls your arm closer to you. Right? In order for your bicep to extend, the only way for your bicep to extend is for your tricep muscles to contract, right? So what we're going to see in this class is that most muscles in your body actually come in pairs. Otherwise, there'd be no way for it to kind of reset itself or kind of, go back to its original position. So almost all muscles have at least one pair. In the simplest case, some of the more complex joints in your body, like your shoulder joint, it's not just a pair of muscles, it's kind of a group of muscles that kind of work in tandem. But it's kind of a useful concept to know that muscles kind of work together and they work in at least pairs. All right, any questions on this? Okay. All right, almost done. All right, so the other concept that I want to go over today is anthropomorphic data. Okay. So throughout this class, we're going to be doing examples with the human body as an example, right? And so we'll be doing computations of the human body, maybe going through a squat or maybe lifting up a load or carrying a load or in a certain posture, right? And so just like any calculations, in order to actually compute results, you need some numbers, right? And kind of the beauty of kind of the human race is that everyone's kind of a different size, right? So the lengths of their limbs, their total height, the relative positions of certain parts of the body, it's all different. And so the result of your calculations are going to change depending on what numbers you plug in for the for all these values, right? So the question I always get asked, in this class, especially in the final project when you're doing your calculations for that, what numbers should I plug in? What should I plug in, for the height of the person? What number should I plug in for, the length of their arm, the length of their leg, the location of their center of mass, things like that. Okay. The nice thing is that, a lot of these values are quantified for, a lot of people. And so if you look up kind of, population average values for height, population average values for, the height of their eyes, the length of their arms, the length of their fingers, a lot of these are kind of quantified, and they're stored in anthropomorphic data tables. Okay. And so, if you ever need numbers for a calculation, or if you're interested to see, kind of where you stack up in terms of the average height, maybe average height for this state versus the average height for compared to, I don't know, to people in Singapore or something like that, right? A lot of data is out there, and so this is mostly just to kind of notify you that the data is out there. You just kind of have to look for it, okay? And it's actually fascinating, and so it's really interesting to see how you kind of stack up compared to other people. Although I never needed a data table to tell me that I'm short. I know that I'm short, but you can see how short you are and what percentile you're short by looking at these data tables online. So here's an example. So here's an example from one of the textbooks that I have. These are kind of the average values for these things. I think these are measured in meters. So, for the stature, so this is your height. You are in the 95th percentile of height if you're 1.869 meters tall. You're perfectly average if you're 1.759, and you're in the bottom 5% if you're 1.649 meters tall. Okay. And of course, most of the data that you're going to see is kind of split between males and females just because of the anatomical differences between them. Okay. All right, any questions on this? And then, a bit more on the sitting one. I believe that's the last slide. Yeah. Okay, so that's all I had for today. I don't really want to jump into the next thing yet, so we'll call it a bit early today. When we come back for class on Monday, we're going to start to get into some review. So we're going to view a bit of mechanics. Oh, question. Oh, you're right. I'm sorry. So when we come back on Wednesday, we'll start getting into mechanics. Yeah, thanks for reminding me. I totally would have come here myself. Where is everybody? Yeah, so I'll come back. We'll come back on Wednesday. So hope you guys have a good long weekend, and I will see you guys a week from now. Yeah, so we're, right now, the department is mostly focusing on getting people into the required courses. Kind of the messaging that we've been getting is that, we're not supposed to exceed 30 people for the electives. But I think they're gonna come down to that, just because there's just not enough electives for people to take. So I would say just be patient, and hopefully I'll have an answer for you early next week.
So even if, like, I know the deadline. From the week of September, but actually.
I believe the last day should actually be a week from Labor Day. That's the last, yeah. So I think you'll be okay. But yeah, just stay tuned. I mean, worst case, I would look into other electives. At this time slot. I think mechatronics is today. I think there's 443. Just have some backup.
This one here.
In case this one, I'm pretty sure that you'll be able to get in the course rate, but just kind of be ready in case you need it. Yeah, I know. We have a lot of people on the wait list. It's been pretty challenging for that. Like anytime we bring up technical records right now, the department was like, I don't want to hear it. We're just it's required for. But yeah, just hang tight. Just have a backup plan. Yeah.
So we'll just keep trying.
Yeah. All right, question. So where can I find the Zoom recording lectures? Yeah, they're on the Canvas site. I was a little bit late in posting the one from Monday just because I was a bit busy this week. But usually I'll try to post it by next week.
Well.